Thank you for tuning in to Fat, Black, and Femme, and I am just so excited to start the show today. It's been a beautiful week in Rochester, and we are checking in today with Black nurses, with a Black nurse in Rochester about the path and journey through the pandemic, and we still are in it despite what a lot of people say, despite CDC guidance. We are still very much in a pandemic, and it's still very much impacting our frontline workers and staff, nurses, doctors, all of them. And we guys know that mentally it can take its specific toll on Black nurses. So I have with me today Dr. Celia McIntosh, and your pronouns.
She and her.
She and her? Okay, like to make sure.
Yeah. Thank you.
So yes, she is very well known in Rochester, I think, and I got your name from Shawnee,
Oh, thank you.
because you are also on the Police Accountability Board, right? Yes.
Yeah, that's true.
Yeah, so big things up in Rochester. If you want to even give you a little more background for everyone.
Yeah. So just a little bit about me. I'm actually nurse practitioner. Dr. Celia McIntosh. I'm nurse practitioner specifically in neurology, inpatient neurology. So I tend to see a lot of patients with strokes, seizures, MS, lots of variety of different things. I'm also a social justice advocate. I do a lot of work around or education around human trafficking. As you mentioned, I'm on the Police Accountability Board, but my focus is really advocacy and really being able to uplift the community and just really to advocate for people that are not able to advocate for themselves. So that's just a little bit about me.
No, it's dope. It's necessary work for the people who dedicate their lives to it. And just while I have you on, the PAB, thankfully, did through the mayor's budget, you guys got a push for the funding that you were asking for, and hopefully bigger things are coming from the board, and as you're able to get this funding once it's approved, and you guys are able to do the work you were put in place to do, and with the staff that you need for it.
Yeah, I think it's historical for us, but it's also historical for the community, because we really want to not give piecemeal solutions. And a part of being able to improve that is really have the funding and have the resources to do the job that you've been essentially elected to do. And when you're on the shoestring budget, you're not able to do that. So we're definitely hoping and excited to get up and get running and do the work that the community has called us to do.
Yes, we're excited to see it. Definitely. So we're just getting into what our topic is here today. Just like a check-in with Black nurses. It's been over a year since this has started. I want to know kind of what your journey was from when we first discovered that COVID was overtaking our lives to now, where it seems like we're finally trying to get past it, but it looks like it's still going to be here for quite some time. Like how did the journey start for you?
Yeah, so I would say in about March, I would say roughly. So some people had the unfortunate situation where they were getting furloughed, and I have not been furloughed, but there were a few people in my department that worked outpatient specifically that were furloughed and having to go to different departments and work. In the beginning, it was just a mess in terms of having the resources. And when we're talking about having the adequate PPE to protect yourself, the appropriate mask, there was a lot of questions about, are we going to have the appropriate supplies? So in the beginning, I would say that was definitely a challenge. There was definitely a lot of kind of modifications in how you would get those supplies. And then there was a lot of inconsistency in the messaging. Oftentimes it was like, well, you have to wear a mask in the patient's room, but then you didn't have to wear it in the hallway where you were kind of walking around with other, people that are just within the hallway, visitors and different things. But as we started learning more about it, then there were more restrictions on when you can wear a mask. And it wasn't just in the patient's room, it was definitely when you're in the hallways, and then you had to wear your shield. So I think some of the issue during this pandemic is not really having the resources, and then not really having the correct messaging. And now when you talk about the messaging again, now we're being told by the CDC that if you're fully vaccinated, then you don't have to, kind of wear the mask. And it's just like, for me, it's just like, we kind of still don't know too much, about this. The COVID keeps evolving, as we learn about it. But in terms of the patient care, I would say what's been affected, a lot of families were not able to come in and see their family members. So a lot of the nurses and providers, I found myself spending a lot more time with patients as I was able to, because they just needed to feel, and not necessarily validated, but they needed to feel like connected to someone, and not being able to have the family come in makes you feel kind of isolated. So I would say that's one of the things that I noticed, that there was an uptick of providers really, trying to spend more time with patients and trying to connect with them. I have a few experiences with a couple of patients that was really heartfelt during that time. In other terms of the clinical aspect, how we were impacted, I work in stroke neurology, so I was seeing a lot more patients that were coming in with stroke. You'd have thought like, okay, maybe it's going to slow down, but no, we were very busy. We had some patients that would even stay home longer because they didn't want to come to the hospital. So when they actually came to the hospital, they had severe symptoms. We had patients that would have to go and get like this endovascular procedure where, they came into the hospital, we found that they had a stroke and they had a clot that would be retrievable. So we were having a lot of those patients in the beginning. At least that's what I had observed. We have a lot of patients coming in with just confusion because of the COVID. So we felt like our service as a neurology service was just getting busier. And I think some of that was the same for others in the hospital, but we definitely noticed it from a clinical standpoint that our patients were sicker.
Mm-hmm. The beginning of the pandemic was so confusing because we're like, what is this? A lot of people didn't know if it was airborne or not. Like, we didn't know how this thing was caught. And even though we know some things now, like you said, the CDC opening up thing, or at least trying to give some kind of steps forward, it still just seems very inappropriate at this moment.
Mhm.
At least in terms of Black people who have the lowest rates of vaccination and have the highest rates of COVID and death, and just opening this up while we are still dying, like while we are still, most of us are still not convinced to get the vaccine. So it's
Yeah.
like, I are you vaccinated?
Yeah, so I did. I mean, I definitely did do the vaccine. I also, like many in the community, thought about, okay,
Mhm.
what's going to be the long-term impacts. I don't know enough about this. And then there was a lot of talk about, how you can be more hypercoagulable, meaning your blood gets thicker and develop clots and different things. So there was a lot of that uncertainty in the beginning. As a healthcare provider, I feel like it was for me the right thing to do, especially when you're talking about taking care of patients. So yes, I am vaccinated. Yes, I know people still have a lot of kind of uncertainty about it, but there's been tons of people that I've spoken to that have had the vaccine, and they've said how how they've kind of been a little sick with it, with a few things, like nausea, vomiting, basic things. But then they say to me, I can't imagine how much worse this would have been had I not gotten the vaccine and
Yeah.
actually got COVID. So definitely in the beginning, like I said, when I saw patients that were coming in and having to be intubated, even at younger patients that were relatively healthy, having to be, intubated, and then, the hospitals being concerned, are we going to have enough ventilators for people? Then to me, that was pretty much very eye-opening, saying, you really need to step up and get the vaccine.
Mm-hmm.
So to your point, yes, I'm vaccinated, but there were, like I said, there's a variety of different reasons and different things, and just seeing some of the patients that, you know very young, very healthy, still being intubated, still having complications, to me, that was just kind of what made me pull the trigger and terms of getting the vaccine.
Yeah, yeah, for sure. And that's the thing. A lot of I don't question Black people's mistrust of it. I don't. I think it's valid. I think um the Black community has had a very tough past, a hard past with the medical industry, with government issued things, and it's a valid response, I think, to be skeptical and criticize it. Um, yeah, and I also like I got it, but I got it after I felt comfortable with facts or whatever was coming out about everything, and just what felt comfortable for me. But like I still do not criticize most Black people who say they are worried about it, because it's something that was done really quickly. It came to
Mm-hmm.
us within less than a year, and and you can't trust everything. You really can't. So yeah, I don't judge a lot of Black people who choose not to right now or are waiting to see more long-term effects. It's definitely a thing. But yeah,
So,
I can definitely see on your side also. It's just like, as a healthcare provider, so many people are coming into your care and your contact every day. Um,
mm-hmm,
like, you want to do whatever you can to keep them safe and keep them
mm-hmm.
healthy, and keep yourself safe if you can. Would you have anything to say to people who are unsure, or anything you think they should look into more, that if they are unsure?
I would just say, and especially as a Black nurse, or just being, like organizations like Rochester Black Nurses Association, we've been working to educate the community, all the community, but definitely Black and Brown communities about the vaccine, what are some of the side effects, and going and doing screening. So what I would say is really get educated about it. Figure out, what are, ask the questions. We're not, like I said, this is evolving. As we learn more about it, we get more information about it. But I would just say, if you're very unsure, if you're still uncertain, get information about it. Like I said, the Rochester Black Nurses Association, we they can find us on Facebook. We're always willing to educate people. They can get in touch with Common Ground Health, because they have formed a speakers bureau. So now this bureau will go out and educate people about COVID-19. So there are organizations here that will educate them. So it's just a matter of, I would say, if it's just the uncertainty because you don't know about the vaccine, or you just have a lot of questions, I would say definitely be more informed. I also don't blame people for being hesitant, for all the reasons that you stated, because we know the history. If we read books like Medical Apartheid, then we know that there's just been a long history of mistrust.
Yes. Yeah.
But yeah, but the starting point is really to be informed. I told my son, awareness is the key, and this is the reality of it. You can make a better informed decision if you are informed and equipped with the information. So I would say starting there would be the best route.
Yes. Okay. Yes, that information. I'll be sure to link that on my Facebook and Instagram when we post this, to help people. That's the biggest thing, is just knowing the most you can. The
Mhm.
most, the information is there, knowing the most you can, and doing with that information what you will. I do want to ask also, has being a Black woman, how has that impacted your journey to getting to your place in your career right now? How has it impacted how you cared during COVID? And I mean beyond that as well.
Mhm. So in terms of my career, just being a Black woman overall, it's had its challenges. I feel like, I had a winding road to get to where I am today. It's not been that, clear path for me. In terms of the challenges in the school, I would say that I don't know if I experienced a lot of the challenges that I'm starting to see currently, with a lot of, Black nurses being turned away from different programs for one reason or another. But I do feel like there were some challenges on the way. I think maybe if I was, that I could have had more of a mentor, or someone giving me, the information. I always felt like I had to go search for it. So it hasn't been, so I guess what I'm trying to say is, it hasn't really been an easy path to get to where I am. But once I got here and been able to, work, within these systems and just learning, just really wanting to, that I think that's what's kind of carried me, seeing injustices in different systems. My initial reason for becoming a nurse was because I wanted to advocate for patients and families. And I think that's kind of the umbrella that has carried me throughout my whole career, saying this is the goal. This is the ultimate thing that you want to do. You want to advocate for patients, you want to advocate for families, and whatever other vehicle I do that in, whether that's through the PAB, whether it's being a nurse at the bedside, whether that's being a nurse practitioner, or whether that's kind of going to Capitol Hill days and lobbying for different things. That's kind of like been the common denominator, I guess, to say. But have I had challenges in my role as a nurse? Yes. I feel like, we've talked a lot about diversity and inclusion. Is there enough of us in, different C-suites and leadership positions? No, there's not. Definitely not. I would tell you that in 2020, McKinsey and Company did a survey of women in the workplace, and there was only 3% of women of color in the corporate space at the leadership level. So when you even think about that and hospital organizations, it's less than that.
Wow.
Yeah, it's definitely less than that. So there are definitely some challenges. I've, had a few barriers in terms of applying for positions and not even being interviewed and being sent a letter saying that they're looking for more experience, someone with more experience. And then you question it. But, so those are some of the challenges that I feel like I faced. Like I said, going back to the diversity and inclusion thing, definitely not enough Black and brown people in the healthcare profession, especially at those leadership positions, the ones that are actually making the decisions that are going to impact people's care. And oftentimes, that's a problem because people need to see people in the workforce that look like them, that can relate.
Yeah.
So that's one of the biggest challenges. So I would say that those have been some of the challenges on the way. And I think this time with the civil unrest, with the pandemic, it's really just looked disparities in the eye. Everything going on has really been able to expose the disparities, and people are organizations and companies are at a place right now where they have to address it because there's a call for that. Yeah. So I think that's where I am right now.
Mm-hmm. And would you have any advice for young nurses who are aspiring nurses in school right now, or, they want to go on the path like you did to get your doctorates and everything? What advice would you give them?
Yeah, I would definitely say keep going. Definitely keep going, because I was counted out multiple times and didn't have the greatest support system. Mm-hmm. But there were a few people along the way that just said, Celia, I see you and I want you to keep going and keep pushing. And, so I also had to encourage myself. But for them, I would say, I come back to talking about the Rochester Black Nurses Association, because we just did a career fair. Yes. Because we want to get, we want to provide support for nurses that are coming up. We've in our own areas blazed our trails, but we not only just want to blaze a trail, we want to step aside and allow other nurses to come up and be able to flourish in their jobs and their positions and being able to create that path for them. Mm-hmm. So I would say one of the things would be looking into our organization as a whole. You want to have an organization, like I said, when you have people that look like you that are doing this work or just being in the profession, then you automatically feel like, okay, they can do it, I can do it too. And for me, like I said, that to me is helpful. And that's why it's also helpful to have that diversity in the workforce, to see people in that level. But just moving on in terms of, the organization itself will be able to help empower them, help inspire them, help mentor them. We're working on doing a couple mentorship programs now. We've partnered with MCH, to help mentor CNAs and LPNs that want to go back and advance their career. So I would say the number one thing would be connecting with our organization or any organization. It doesn't have to be ours, but having, getting into an organization where you're with people that have already advanced their career. They can share the path with you. They can share their experience with you. That would be one of the things that I would say would be helpful. I would definitely say, do your research in terms of what type, of nursing you want to do. I would say, you don't have to kind of, oftentimes we think as nurses that we have to do it all. We have to, carry this heavy load. You can take one course at a time. You don't have to overwhelm yourself. It done is better than perfect. So I would say, start, if you're considering going back and you're not there yet, or I would say, find the appropriate resources, find an organization that's willing to support you and educate you and lead you in that direction. I would say, don't be afraid to ask questions. Don't quit. Keep pushing. There will be people out here that will tell you, you can't do it. Who do you think you are? I faced all that and I've looked that right in the eye and kept pushing and kept going. So I would just say, don't be discouraged. Definitely keep going. Reach out. I could leave you my email as well, but definitely I could say connect with me if you have further questions, and challenge the status quo. Challenge. If you're getting rejected from certain programs, question why. Talk to the deans or the schools and figure out what the issue is. If it's a matter of writing an essay or different things, there's ways to improve that. So I would say, don't let that discourage you. So I know I've said a lot of words, but I'm passionate about that because, like I said, I was counted out too. I was told, you're not good enough to go to school. You're not good enough to do this. You're not good enough to do that. And, I don't feel like I'm where I need to be yet. I'm not, all my goals are not checked off, but I would say, what, despite all that, I'm still staying focused, looking at, what's at the end of the tunnel for me. And that's what I keep in mind. So I'll stop talking.
It's a lot, but it's so necessary. It's having even mentors that you even know in the community, not even that you talk to all the time, but that you see doing what you want to do. And that's the really important part, I think, of this show, this segment right now. Is just, I even have a family member who is starting her nursing, is going to be an RN in September, who has been a home health aide for a few years now. And it's just, I think even for her, not local, it would be still such an inspirational thing to see someone doing what you want to do and succeeding. And it's a big thing. And hearing those words of encouragement sometimes are all that people need. They just need to know that someone somewhere believes in them. So I think that's super, super important. And just on another important topic, the pandemic's taking its toll on not just physical, but also mental health. How have you taken care of your mental health since the pandemic began?
Well, I don't think one of the things that I really used to love to do was working out, and I've kind of gotten off that path for a while. So I'm trying to slowly work my way back up to working out again, because I just realized these endorphins, it just really helps your mood, your energy, your focus. So me, that is one of the ways that I definitely want to get back to in terms of helping my mental health. I've been reading, I think one of the challenges too, because of a lot of the advocacy work I do, you feel you're immersed in everything that's going on. I mean, come on, when you talk about being on the police accountability board, and just thinking about the work that we do, and just everything that's been going on, that can take its own toll on you. And then, working in the healthcare system where you're constantly seeing patients, intubated, not feeling good, not being able to, have families come in during this time. Those things can weigh on you. So for me, I've also been trying to get things crossed off my list. I started a few different businesses, like in, Dr. Celia's Closet, where I resell some of my items that I have here. It's something fun. It's something kind of cathartic to, I I guess just, make me feel like I have a purpose. I don't know.
Mhm.
So I did that. And then I started an online coffee shop called Pour Me a Cup, just because it's been something I've been interested in. But during this time, I had some time to do some of those things. Other things that, individuals can do, they can walk, they can read, they can do yoga. The gyms are definitely opening back up now. So, working out when they have time. I would say, practicing mindfulness, that's been helpful. That's one of the things that actually my job did in the beginning. They would provide, like, they had these Zoom calls for sessions on mindfulness. And just to be able to get on that call and hear, other people kind of exchange their stories about how they were doing during this time, I think was helpful. Um, I've been finding myself doing a lot more education on things like COVID-19 and mental health, just to make the community aware. I just did a talk on mental health and youth in the pandemic. And, so even those things, being able to read and process and put those things together, I feel like, that's helped my mental health, because I'm able to help other people understand that, this is a bigger thing. This, other people are being infected and impacted rather. And this is a way for me to kind of do more advocacy by educating other people. So while it's not like me sitting on the beach somewhere,
Mhm.
those are some of the things that I like to do that I know still helps the community to, help people understand what some of the challenges are, and, ultimately equip them with, some, or just give them some tools or just some knowledge that they're aware and they may be able to implement some things in their life. So.
Yeah, self-care looks very different, all right, in different ways, and has many different forms. Sitting
Mhm,
on the beach isn't the only way.
mhm,
Sometimes you can't escape life. Sometimes you got to get self-care while in it.
mhm,
I think that's sometimes people don't understand. Is like sometimes you really just gotta. You're not gonna get a break. That's the one thing. Life is like, you know, I sometimes I feel like a nurse because I watch 17 seasons of Grey's Anatomy, and
mhm.
and I know these little terms and stuff, but but like one of the characters would say, life is a carousel. It doesn't
Yeah.
stop. It keeps going. It keeps going.
Mhm,
And
mhm,
you gotta find time within that for yourself and to advocate for yourself and and I know it's a journey because it's like, who am I to say I need a break? Who am I to say I need this? Because so many other people are going through worse, and it's just like, but your pain is still valid. Your mental health is still
yep,
valid. It still needs to be taken care of. Um,
mhm,
and I think that's a big thing that people have to understand. And the pandemic has not helped. We've gotten to a point, like you said before at the beginning, the loneliness of it all alone, having to
yep,
quarantine and be away from people you love. And
mhm,
I went about 8 months without seeing my mother,
mhm,
who only lives in Buffalo. I
mhm,
wasn't able to go up. Now I'm going up and I'm fully vaccinated. She just got her second vaccine yesterday. My uncle, who made a rare visit from New Jersey, and he's fully vaccinated, and it made us feel a lot more safe. Um,
mhm,
because we also have a high risk grandmother. My mom is also high risk,
mhm,
and it made us feel more safe to gather and to be together.
mhm,
And at this point, it's like you would do almost anything to bring that back, to
mhm,
have that safety net of being able to see
mhm.
each other. So it's
Yeah, and yeah, and one of the things that while we understand that this social distance it's really physical distancing, and because of that, people still need to, even if you're away, let's try to interact by phone,
mm,
have a conversation. I think I don't know if some people have gotten back to writing letters. I don't know if
yeah,
that seems to be some kind of foreign thing, but I would still say connect virtually if you have the broadband or the Wi-Fi or the ability to do that,
mm,
because it's about, yes, it's really physical distancing, but we don't have to cut off communication from people. And I think we've kind of gotten away from, yes, we're isolated, but yes, we still need to reach out and talk to people and connect.
mm,
One of the other things that I think you were mentioning that kind of popped into my head, I really want people to understand there is, even today as we speak, May is Mental Health Awareness Month.
that's-
And I want people to understand that, yes, there is a stigma, but the stigma about mental health is, we can dismantle that stigma. we can bring more awareness to that. We have to understand that taking care of your mental health is just like taking care of your physical health, So, I mean, would you, if someone was a diabetic, would they let their diabetes go unchecked? If you had a broken leg, would you just let the bone sit out, untreated? No. I mean, so why would we, let our emotions, go unchecked or not taken care of or addressed because someone says, oh, it's taboo to talk about it. I think that, we definitely need to dismantle the stigma
Yes.
around mental health, because we know that, mental health affects your physical health. If you're feeling depressed, then you're not going to be motivated. And if you're not motivated, you're not going to want to go to work. And if you don't go to work, then you're going to lose your job. And then if you have lost your job, then you can't pay your bills. And if you can't pay your bills, then you can't pay for your house. And now you're homeless. And you know what I mean? So when we start thinking about life like that in those different stages, we have to understand that mental health is a priority, and that we definitely need to dismantle the stigma. And my point is, take care of your mental health. Go see a therapist if you need to. If you've seen a therapist and that therapist haven't worked for you, see another one.
Shop around.
The buck doesn't stop there, because the focus is you. There's so many benefits from being emotionally regulated and being in check and being able to manage that with life. Because honestly, and even learning coping strategies, because like I said, even with this pandemic, just being a nurse working in this environment, we've had to be resilient, really resilient. It's not that none of this bothers us. It's that we still have to get up every day and look at the big picture. We're trying to do the greater good for, the patients that we serve. So it's not that we're not impacted by that, but like I said, we have to try to be resilient. And oftentimes that means being mentally resilient. Yes, we're very fatigued in certain ways, but we have to keep our emotions in check. And we have to also, I advocate for people seeing a therapist if they need one.
Yes.
No, like I said, that's the biggest takeaway here, that you have to prioritize yourself. And oftentimes some of the patients that I've seen, and that's why I actually went back to my psych NP, because some of the patients that would come in would have physical symptoms, or it would be triggered by emotional stress, that now their body is saying that they have left-sided weakness, or they have this headache, or they have this vision problem. And it's really, and after you tease it out, it's really the stress. And now because of the stress, their body is responding this way. So like I said, overall, if you don't get that mental health addressed, then it can manifest in different things, in physical symptoms. And anxiety, can, you feel like you're dying, you feel like like you're having a heart attack. But like I said, seeing a therapist if you need one, talking to someone. We know that the rates of suicide have gone up. We know that there's increased rates of depression and anxiety. So I would say definitely social isolation, all that is contributing. So I would say, don't stop connecting with people, find your support system, but definitely talk to a therapist or a counselor or whomever, but don't allow your mental health to go unchecked.
Yes.
Because it's important.
Yeah, like you said, it's just as important as physical. You don't want to get to a point of no return. That's, you want to make sure you're getting help along the way, and there are so many resources and things out there. And even if, like, I just want to, because we mentioned suicide, I every time I mention that, I want to mention a hotline, 800-273-8255. It's a suicide prevention hotline. Help is always there, 24 hours. And it's, mental health needs to be in the Black community. We, like, even seeing my family, I was at my family's yesterday, and just saying, hey, y'all got trauma, y'all should go see a therapist, and a lot of times they see it as like, oh, they'll go towards religion instead, either religion, or they'll be like, that's a white person thing.
Mm-hmm.
And it's like, On the religion part, I'm not a very religious person. I honestly identify as agnostic, but it just, for me, what religion and faith seems, it seems faith is only part of it. Um,
Hmm.
you also have to have some kind of physical move in order to make something happen. Your faith alone is not going to get you somewhere. And it's just, and just saying to, and my mother in particular, and calling her out a little bit, um,
Hmm.
you need another piece to that, you know?
Yeah, as you were speaking, I was thinking about that I guess proverb where it says faith without works is dead. So this is the works part of it. It's just like going and getting those services that you need to help you navigate your life. Especially, I mean, come on, when you're thinking about just day-to-day stuff, and now you add this whole pandemic, then
Yeah.
you add, especially for, single moms, let's say, talk about them for a minute. Let's talk about, the pandemic and schools being closed,
Yeah.
childcare is being closed, economical recession when, people have lost their jobs. I do a lot of education around human trafficking. And even during this time, there was limited resources, lack of funding. When you even talk about food pantries, a lot more people were accessing food pantries that had never accessed them before. So when you're just thinking about this whole cascade of things, or just, these things piling up on you, it's just like day-to-day life is hard enough. But when you couple all these other things on it, you feel like you're going to break,
Mhm.
So I would definitely say advocating for those services is very much needed.
Yes, yes. Yeah, so whether, and it's not a white person thing, it's everyone has mental health issues, guys.
Yeah.
We need to find the therapist that works for us, that will help us break down all that trauma and all. You'll
Mhm.
figure out, I think with my journey in therapy, I figured out partly like maybe why I do certain things I do. And it does lead back, because you think for a little bit, maybe your trauma doesn't impact you anymore. Maybe you're fine. And then you realize, oh, I do this a certain way because of this. Like, it goes
Right.
back to that. And it's
Mhm.
mind blowing how this
Mhm.
stuff is impacting us. And figuring that about yourself is such a huge journey and such an important one. And I can't stress it enough. We do a lot of mental health talks on the show. And
Mhm.
I do it every time I have a somewhat medical professional on, because I can't stress it enough how important I think it is, and how I really want the Black community to get on board.
Mhm.
We gotta start taking care of that generational trauma that's just been there. The world does not like us. So we have a lot of trauma to unpack and
Yeah.
to figure
Yeah.
out as a whole.
Yeah. Yeah, and definitely, like you mentioned, it's not about, just white people with mental health. Everybody in their own right may have some, everybody, I think everybody at some point in their life has some episode of depression, whether they're saddened by a relationship breakup or whatever. And then people just definitely learn how to cope with things differently. But I think at every point in someone's life, there's a tendency to be anxious. Even about giving a presentation, you're anxious, but just it happens to all of us. No one is immune from having these, things happen, and especially like unpredictable life stressors, so I would definitely say I'm always an advocate for getting the help you need. And I would say, don't let anyone, don't let people keep telling you that it's not okay to talk about your problems. It's not okay to talk about your feelings. It's perfectly fine. And if you feel like, that your support person, or is not that person to do that, then find someone that can create a safe space that's willing to do that. Because I think we all need to, if we're going to be vulnerable and talk to people about things that are going on in our lives, then we need a safe space for that. And I know Melanie Funches, I'm sure you've heard about her in our
Yes.
community. She started a lot of emancipation circles, really wanting to bring the community together to talk about mental health. And she actually just started her own company. I think it's Ubuntu something. I don't have it off the top of my head, but I would say definitely she was having she was creating these spaces so people can have these conversations, because like you said, this trauma is kind of baked in us, and if we don't address it, it's going to affect every part of our life.
Yeah.
Mhm.
And with that note, I think it's time to, that's what I want to leave you with. That's what I want to leave the audience with. Mental health is the biggest thing. And we thank nurses like you on the front line who have honestly put their mental health to the test during
Mhm.
the pandemic. And I mean, even before, just that profession in general is definitely, it's not an easy profession. It's definitely a lot of uh ingenuity that goes into it. And for me, I want to thank you for that, for what you do, your countless service on the PAB, everything. Like, you're definitely a great community member and someone that knows their community, is getting into it, and is trying to better it the way you know how, the way you want to. And I can feel that. So I want to thank you for that. Also want to thank you for joining me on the show today, and for your expertise and everything you've had to say. This will air this upcoming Saturday. Um, and yeah, thank you for that. And thank you for tuning in if you're listening on WXIR, or if you tuned into our YouTube channel or Facebook. Thank you for watching Fat Black and Femme today. And be sure to stick around next week for so much more. Dr. Celia, thank you so much for coming on. Have a wonderful day.
Thank you. Thank you for having me.
All right.
Bye-bye.
Bye bye.